that it takes business practices that are perfectly legal and acceptable and encouraged in every other industry, and it makes them a federal crime when it involves healthcare.
Hi, welcome to HIMSScast. I'm Kat Jersich, Senior Editor at Healthcare IT News. In February, the federal government announced that the DOJ's Civil Division had recovered more than $5.6 billion in settlements and judgments under the False Claims Act, or FCA, for fiscal year 2021. This was a huge increase from the previous year, and almost 90% of that money was related to health industry claims. Here with me today to discuss FCA enforcement initiatives over the past year and predictions for the next year is Ethan Davis, partner at King & Spalding. Ethan, thanks so much for joining me today.
Thanks for having me, Kat. Happy to be here.
Let's get started with a look back over the past year with that enormous increase we just discussed. So what changes have you seen with FCA enforcement initiatives over 2021?
So I've seen a number of things, Kat, that have changed. I think one of the first developments is a wake up from the Justice Department on post-acute care enforcement, including enforcement related to skilled nursing facilities. We saw a bit of a lapse of this enforcement in 2020 when SNFs were at the core of the pandemic, and the government seemed to give them a little bit of a break. But I think that the government has woken up, and we're seeing a lot of activity directed at skilled nursing facilities and other post-acute care providers now, and we saw that throughout 2021. I think we're also seeing, as a second development, a wake up from the government on private equity enforcement. So private equity has been investing in healthcare and the life sciences to a greater degree over the last several years than it has in the past, and DOJ has been looking for ways to hold private equity companies directly accountable for perceived misconduct committed by their portfolio companies. And then the final example I'll give is the new DOJ cybersecurity initiative, which is led out of the Civil Division, the division I used to run at DOJ. There is a tendency when new leadership comes in to DOJ to put a shiny new label on stuff that the lawyers have been doing all along. And to a degree, that's true with cybersecurity. Cybersecurity, FCA enforcement has been a thing for several years now. But what I think this new initiative shows is that this initiative now has the serious backing of the highest levels of the Department of Justice, and it's something to pay close attention to in the months and years ahead.
Definitely. Could you go into that a little bit more? What does this cybersecurity initiative entail for listeners that maybe aren't up on that?
So, anytime a company does business with the government, has a contract with the government, the contract generally incorporates some requirements around cybersecurity, protection of patient data, obligation to report data breaches, et cetera. And when companies fail to comply with those obligations, that can trigger a False Claims Act case. And obviously, those protections have become more important during the pandemic when so many things are happening virtually, and as technology continues to advance, those and data breaches become more and more common. This has become an area that the government is really focused on. The cybersecurity initiative is a new program or a new working group or whatever you want to call it, that is, as I understand it, headed by the Civil Division's commercial litigation branch, but it will also include a variety of other components of the Department of Justice. So it remains to be seen exactly what they'll do, but at the very least, it signifies a more concentrated government focus on this area.
Definitely. And you did mention how the pandemic has sort of shifted approaches to cybersecurity. Are there other ways that COVID-19 has affected the federal approach to fraud investigations? And how might health providers feel some of those shifts?
There sure are. Well, I mean, I was running the Civil Division during the early days of the pandemic, so I can tell you firsthand how it affected the nuts and bolts of how the government was operating. I mean, everyone was immediately working from home. That the government is not used to that, or at least was not used to that back in 2020. We didn't have any real ability to do video calls, at least where I was sitting. I know other components of DOJ did. So that just inflicted an immediate slowdown, I think, across the board in terms of all sorts of investigations. Now, even today, still today, the main justice offices are still working from home. And so that slowdown has persisted, I think, even through the present day. Now, the government lawyers are getting more used to it, and they now know how to do video calls, and it's easier for them to work uninterrupted from their homes. But I think there is still an inherent drag on on how fast these investigations are proceeding, but they will return eventually. Things will ramp up again, and I think we can foresee a serious increase in activity, probably starting in the next couple of months and persisting over the next few years. On a more substantive note, what I'd flag about the pandemic and fraud investigations is obviously the CARES Act, and as relevant to healthcare providers, the Provider Relief Fund, which was established as part of the CARES Act. It injected hundreds of billions of dollars into healthcare providers in order to keep them afloat during the pandemic. But obviously, like everything that comes out, like all the money that comes out of the federal government, it came with strings attached, including rules about how the money could be spent. And although we haven't seen a huge amount of activity in terms of Provider Relief Fund investigations yet, I think that's because the complete story of the program is yet to be written, and reporting is still happening. And I think there's going to be a long tail with Provider Relief Fund investigations going forward. One final thing I'd flag in terms of the pandemic and fraud investigations is clinical trial fraud. During the pandemic, clinical trials became a lot more difficult to conduct. It became harder for pharma companies and medical device companies to oversee them because a lot of the activities were happening remotely. And DOJ has an ongoing initiative now to root out and find clinical trial fraud. They've brought a number of indictments and criminal charges recently involving investigators and contract research organizations. And I know that DOJ is trying to work its way up the chain to pharmaceutical companies and medical device companies that sponsor these trials. Healthcare providers, to the extent they participate in these trials, should keep a close eye on that development.
That's really interesting. And you've mentioned a few kind of enforcement trends here. Are there any others that you think healthcare providers should kind of keep an eye on going forward?
Yeah, I think one thing I haven't mentioned, but that should be at number one on the list for all healthcare providers at all times, is the Anti-Kickback Statute. And that, I cannot overstate how focused DOJ is on the False Claims Act and the Anti-Kickback Statute in particular. That I'm handling quite a few False Claims Act investigations right now, and 9 out of 10 of them have some connection to the Anti-Kickback Statute. So that, for healthcare providers, that means keeping a close eye on your relationships with physicians, medical directors. Any payments that are headed out to physicians are a subject of serious DOJ scrutiny. If you're on the life sciences side, if you're a medical device company or a pharma company, that means keeping an eye on your consulting agreements with physicians, any other speaker programs that you may be sponsoring, and anything else that could implicate the Anti-Kickback Statute, because it is an exceptionally broadly worded statute. It makes it illegal to provide any remuneration, which is defined as anything of value, to a healthcare provider to induce business out of that healthcare provider. And at least that's how broadly the government interprets it. I take issue with that broad of an interpretation, but that's how the government views it, and that is triggering, in my direct experience right now, a very large number of government investigations.
I am remembering, as you're talking about, an anti-kickback statute case involving electronic health record provider, where I think they took doctors that conduct to the Kentucky Derby, if I'm remembering correctly, and it's a whole situation, and that did come up in the settlement.
So you're remembering correctly. There are electronic health records is a stated DOJ area of focus, and all of those cases involve the Anti-Kickback Statute in some ways, and many of the recent resolutions involved allegations from DOJ that the electronic health record company took healthcare provider customers to expensive resorts or on expensive trips, expensive dinners. And so that's another branch of the anti-kickback statute tree.
Absolutely. I do have to admit that I enjoy reading about those cases and seeing the lists of all the alleged perks that provider customers were getting. It's kind of entertaining and a sea of sort of dry legal documents.
Yeah, the fact patterns in these cases tend to be some of the more entertaining ones. The trouble with the anti-kickback statute and why it ends up being so relevant here and gets enforced so often is that it takes business practices that are perfectly legal and acceptable and encouraged in every other industry, and it makes them a federal crime when it involves healthcare. So it's easy for sales reps who may not operate exclusively in the healthcare space to get tripped up by it. They think this is what they've been trained to do their entire careers, and then all of a sudden, if it involves a healthcare provider customer, it's suddenly illegal. So it's a situation where this statute goes against all sorts of business common sense, and that's why it's resulting in this number of enforcement.
That's a great point. And I also wanted to make sure we talked about somewhere in this conversation about telehealth, because obviously that's seen a huge uptick during the COVID-19 pandemic, and telehealth fraud has been a recurrent concern among those thinking about permanent policies to instate, specifically federal legislators. It comes up a lot. And we have seen some cases in telehealth fraud enforcement. And so are there concerns specific to health tech and telehealth that you'd like listeners to be aware of when it comes to virtual care?
I think so. To state the obvious, telehealth has become a major component of the delivery of healthcare services in this country during the pandemic. And while some at the beginning thought that that telehealth would go away once the pandemic ends, it's now clear that regardless of when the pandemic ends, telehealth is here to stay. People have gotten used to it. HHS is likely to make its telehealth waivers permanent, at least to some degree. And so this is a phenomenon that we're going to be dealing with for quite a long time. The other point that makes it more relevant is that telehealth increases the opportunities for interactions between patients and doctors because it's easier to get on the phone with your doctor when it's just a telehealth visit, which in turn increases the number of claims for payments submitted by doctors to federal healthcare programs, which in turn increases the opportunity for enforcement. And so I think what you'll see going forward is DOJ suspicions about issues like, did the doctor actually spend enough time with the patient during a telehealth visit in order to really write that prescription? And you'll also see DOJ scrutiny of claims submitted from telehealth visits to see any suspicious trends in the data. I think you'll see that. And then I think what we've already seen, and what we may see more of, are DOJ prosecutions and False Claims Act investigations involving telemedicine companies. And the fact pattern that we've seen already is a telemedicine company that DOJ says would go out and recruit Medicare beneficiaries and then connect them with doctors who would then write the beneficiaries prescriptions for various items. But according to DOJ, the doctors never actually saw the patient either in person, never even had a telehealth visit. It was just a mechanism, according to DOJ, where the company would serve as a channel for claims submitted to the federal government.
I've heard about some of those as well. And again, those cases often involve details about what the accused individuals spent their money on, which again, I very much enjoy reading. One of them involved buying a jet ski, and that really stuck with me. That was involved in the press release from DOJ about it. So given everything you've outlined, you have touched on a number of ways that providers and organizations might mitigate some of these risks. Is there anything else that comes to mind so that providers, organizations, stakeholders can protect themselves?
Yeah, I think that one really important thing to do is to look at data. So, it used to be, and it still is to a large degree, that DOJ False Claims Act enforcement was driven by relator key tam lawsuits. Something north of 80% of all DOJ False Claims Act investigations begin that way. And that has the effect of outsourcing DOJ enforcement to really private parties. But that, when I was the head of the civil division, that started to change a little bit. We started to focus more on initiating our own investigations and not relying as much on what whistleblowers are bringing to our attention. And the way we did that was through data analysis. And we would look for outliers in the data, look for other corroborating information to suggest that something might be afoot, and things would start. And I think what you'll see over the next few years is that data analysis inside the government will play an increasingly significant role in identifying potential enforcement targets. And what that means for healthcare providers is take a look at your own data before the government sees it. See whether it might appear to the government as an outlier on a particular metric. And if you think you might, then take a look at why that's happening. Do your own internal investigation so you have an explanation for it and an answer. And even if that internal investigation turns up something wrong, that means that you can fix it before the government gets to it, which can result in a lot more credit. The other thing I'd say in terms of providers protecting themselves is to conduct your own proactive compliance assessments of your compliance program. And now there's a couple ways to do this. There's the way that most providers and companies like to do it, which is a review of the policies and procedures. You talk to the compliance personnel, you try to get a sense at a more general level of how the program is operating, and that's fine, that's good. But what we've been doing for some clients is a more aggressive kind of compliance review, where you actually look at the real source of risk, or the most significant sources of risk in a company, which is always the emails. And ways to do this through a blinded email review, so it's not too intrusive. But the way to get a sense of what the real risk is to do that kind of compliance assessment.
That's great. Are there any other predictions that you might have going forward? We've reviewed a lot today, so I understand if the answer is no, but are there any other elements that you want to make sure listeners know about looking forward into 2022 and beyond?
So I think we've covered most of it. I will say that I think, again, on kickbacks, you can expect more turbocharged kickback investigations because DOJ sticks with what works. And on the kickback side, speaker programs are something to pay attention to because DOJ and OIG have fired shots across the bow for those programs. So as the pandemic recedes, hopefully, and in-person speaker programs come back to the fore, I think that's going to be an area to watch. Great.
Well, thank you so much, Ethan. This has been a great conversation, and I have really enjoyed talking to you about this.
Happy to do it. Thanks for having me on, Kat.
Of course. And to all our listeners, thanks for tuning in. If you liked this episode, please rate and review us on Apple Podcasts, and stay safe out there.